What is a malignancy?
Malignance. Mm, that's for suspected malignancy.
If you don't know, that's fine. I'll explain it to you.
Yeah.
So a malignancy is a type of cancer that it spreads. It's aggressive.
Okay.
So that's what a malignancy is. Malignancy usually means something bad. It means it's an aggressive cancer that spreads to other healthy tissues, and that can cause the cancer to spread. Okay.
Okay.
There's another word that we use to describe the spreading of cancer. It's called metastasis.
Oh, metastasis.
Yeah, metastasis is the spreading of cancer. So when we have different types of cancers, a malignant cancer is that type of cancer that's very aggressive and that it metastasizes, which you don't want.
Okay.
Okay. You also have a type of cancers that don't have this quality, and those are known as benign. And so benign cancers, they're not aggressive. They do not metastasize. So those type of cancers are easily removed and easily controlled. Make
Oh,
sense?
yes, sir.
All right. Now, what side of your what side of your abdomen, what quadrant is your liver found
The liver.
in?
I think the liver is somewhere at the back.
No. If we're looking at the patient, right,
Yeah.
and this is the abdomen, and we divide it into four
Oh,
quadrants,
oh, okay.
the liver is found right here on the right side.
Right, sir. Oh,
Now,
okay.
the patient's right side. Notice that this is the patient's left side. This
Mm-hmm.
is the patient's right side. So
Mm-hmm.
keep that in mind, because when we're looking at our patients, their left and right is the opposite of ours. Make sense?
Oh, okay. Mm-hmm.
So the liver is going to be found in the upper right quadrant.
Upward quadrant. Okay.
Okay. So let me explain this question. When it says a nurse is caring for a client, you have this patient. They are scheduled. They're scheduled to undergo a liver biopsy for a suspected malignancy.
Okay.
So the liver biopsy, by the way, is where they get a little needle like this, little syringe, and there's the needle that's going to go inside. And what we're going to do is we're going to aspirate. We're going to remove some tissue in here so we could then put it under a little petri dish, and then we can have little observation so we could find out if that malignancy is cancerous, or if that cancer is malignant or benign.
Oh,
Does that
benign.
make sense?
Benign. That benign. Benign. Right.
Yeah, benign. That means it's good prognosis,
Okay.
meaning that it's not going to be aggressive, it's not going to be spreading, and you have a high likelihood of surviving that type of cancer.
Okay.
Okay, malignant, that's bad. And if I know, I'm not sure if you, I don't think you speak Spanish, but do you know what the word mal is? Have you ever heard the Spanish word mal?
Mal?
Yeah, mal.
No.
How about this word, malodorous? That's not how you
Oh,
spell it, but
okay.
so the word mal means bad. So
Bad.
just
Yeah. Mm-hmm.
yeah, so just keep that in mind.
Okay.
So when we have a malignancy, that's a bad thing. Okay.
Oh, okay. Okay.
So we try to use word association, just things that we can remember so it could
Okay.
help us. Okay. So again, so this patient's having this procedure, or they're about to have it. A nurse is caring for a client who is scheduled to undergo a liver biopsy for a suspected malignancy. Which of the following laboratory findings should the nurse monitor prior to the procedure? Now, listen, when it
Okay.
comes to a liver biopsy, Mr. Tayo, there's a lot of blood supply in there. The liver is one of the most vascular organs that we have. That means that there's a lot of blood supply in there. And
Mm-hmm.
so one of the biggest, and I'm drawing blue now to show you that there's, veins and arteries in there. And one of the biggest potential complications with a liver biopsy, as this needle is entering your liver, is
Yeah.
bleeding.
Bleeding. Mm.
Bleeding. Bleeding is a big issue. Okay. However, let me give you the whole concept real quick, okay?
Okay.
When somebody is carrying this procedure out of a liver biopsy, let me clear some of this stuff out so I can make more room for myself. Okay, when someone's having this liver biopsy, there's some pre-procedure things that we have to know. Pre-procedure. This is before the procedure. What do we have to assess? Well, we have to assess. Have you ever had a surgical procedure, Mr. Tayo?
No.
No, neither have I. It's been a long time. But my mother just went in for cataract removal. Okay. And so we don't have to focus on the cataract removal, but just understand this. Any surgical procedure, are we going to cut into the patient?
Mm-hmm.
Are we going to have a degree of anesthetics that the patient is going to be placed under? Do you know what I mean by that?
No, I don't get it, sir.
No, it's okay. So if a patient's going to have a procedure, like any procedure, they're going to have some type of anesthesia.
Okay.
So these are all things that I want you to start to consider whenever we discuss procedures. I'm not going to go into it just yet. I'm just trying to plant the seeds right now. Okay. So then we can water them and then we can understand the concept a little bit better. But my point is, you as a student, as an NCLEX student, Mr. Tayo, you need to realize that before any procedures, there's going to be some type of anesthesia, preparation, things like that. There's also going to be labs. Labs is when we look at the patient's laboratory values and we find out if there's anything in there that's going to be a contraindication.
Okay.
Indication. So let me ask you, Mr. Tayo, understanding now that this procedure of a liver biopsy is the insertion of a needle into this organ that has a lot of blood supply, what type of labs are you concerned with? You don't have to know the exact lab, the exact lab name, but explain to me, what's your concern knowing that this needle is going into this organ that's very vascular? And if you don't know, it's okay. Let me know and I'll explain to you.
I don't know.
I guarantee you do know. You just don't know because I'm asking you and you're a little stressed out. Well, if we're going to go with a needle inside of an organ that's very vascular, meaning a lot of blood supply, isn't bleeding?
Yeah, to be still bleeding.
Yeah, of a concern. So let's follow that logic, okay? If we're thinking about bleeding, then we also have to think about what labs deal with bleeding. Well, first of all, are the patients on any medications?
Okay.
What type of medications deal with bleeding?
My God, I've forgotten.
No, it's okay. How about these? Blood
thinner.
Yeah, right. Blood thinners. If your patient is about to have a liver biopsy, but they're taking Coumadin. You remember Coumadin?
Coumadin.
Do you remember heparin?
Heparin, yeah, I remember all those, yeah.
How about this one? Aspirin.
Yeah.
How about this one? Enoxaparin.
Exactly right. I didn't remember that.
Okay, write it down.
Okay. So they are, all these medications are blood thinners, right?
These are all considered blood thinners. You also have another one right here. Clopidogrel. I think I misspelled enoxaparin. Hold on. Enoxaparin, like that. There you go. My point is this, Mr. Tayo. Write them down. Become familiar with them because we're going to be revisiting these drugs over and over again as we go through the review session. So when it comes to enoxaparin, when it comes to aspirin, Coumadin, heparin, clopidogrel, these are all going to increase your risk for bleeding, correct?
Okay.
So that's part of your laboratory work in the sense of we're looking at medication. This is all part of your pre-procedure checklist. What are we looking for? You as a nurse, you need to be able to identify medications that place the patient at risk for complications. In this case, it's bleeding, understanding that the liver is highly vascular. Does that make sense, Mr. Tayo?
Yeah.
At the same time, those are the medications. Okay, now we got those. They all increase the risk of bleeding. Now let's talk about labs. What type of labs do you know, are you familiar with, that give us an idea if the patient is at risk for bleeding? Do you know?
I've forgotten.
No worries. Here we go. Let's talk about a few of these lab values, okay? And right now, I don't need you to memorize them just yet. I'm giving you a thorough idea,
Okay.
picture of what you have to start, the way that you have to start thinking. You're like an investigative reporter. You're like a journalist. You're like a detective, that you have a situation with the liver biopsy. Now you have to start gathering data, and you have to start exploring situations that will place your patient at risk for injury or death. Let's continue. For Coumadin, you have to look at something called the PT-INR. Okay?
Yeah.
For heparin, you have to look at something called the PTT. And for all the other drugs, aspirin, enoxaparin, clopidogrel, all those other drugs that I wrote down that you probably haven't heard of too much, you have to assess the platelet count.
Platelet count, okay.
Right? They're also known as thrombocytes.
Thrombocytes. Oh, okay.
And the normal value is 150,000 to 400,000. Okay, write this stuff down. It's okay. And Mr. Tayo, don't get overwhelmed. Right now, we're just writing. All I need you to understand is the idea that the liver is vascular, so we have to look for bleeding. Make sense?
Yeah.
There's going to be a point where you will be able to at least explain to me why each of these things are important for this patient. Right now, all I need you to understand is that the patient might be at risk for bleeding. Excuse me, sorry about that. Make sense? Oh, hold on.
Yeah.
I'll just come back to it. Okay. Anyway, any questions on that so far?
No, I'm getting it.
Okay. Let me know when I can move on to the next thing that I want to discuss right now.
Yeah.
Okay. Now I want you to understand this other idea. We have another organ on top of our liver. What is that?
The kidney?
No.
Oh,
lungs. Yeah, there's two of them, right?
Yeah, it's up there. We have two lungs.
Yeah. I didn't draw the other one, but check this out. Because of the proximity, because of the close space between the liver and the lungs, you have to be very careful when having a liver biopsy, because you may accidentally poke the lungs. And you may develop something called a pneumothorax.
Pneumothorax, okay.
Which is a collapsed lung.
Pneumothorax, collapsed lungs.
Yeah. So all I'm trying to explain to you, Mr. Tayo, is that as the LVN, as an RN, as a CNA, I don't care, as a human being, now we're going to be learning about these potential complications, these potential contraindications, meaning situations or medications or labs that are going to prevent the patient from undergoing this procedure.
Okay.
All right. So again, we've talked about a lot, Mr. Tayo. Don't get overwhelmed. I know this is a lot, but the reason why I'm doing this is because I'm trying to paint pictures here, literally almost, with the situation. All you need to know is this: the liver. What do you know about the liver so far, Mr. Tayo?
The liver is has a lot of blood.
That's correct. What organ is on top of the liver?
The lungs.
And so when you're putting that needle inside the liver, there's two things that you may have issues with. Because the liver is very vascular, what will that needle present as a problem?
Bleeding.
And because the lung is so close, what may develop?
Pneumothorax.
That is correct. That's what I need you to know. Any questions, Mr. Tayo?
No, I'm good.
Okay. May I clear this out?
Okay, yeah.
Okay. Mind you, Mr. Tayo, there's more labs, there's more medications that we can still talk about, but those are the important ones. And that's really, once you get through with this, you'll be able to just have an idea that, oh, those are the elements that we have to consider before carrying out this procedure. Okay, bleeding, atelectasis, things like that. Okay, a nurse is caring for a client who is scheduled to undergo a liver biopsy for a suspected malignancy. Which of the following laboratory findings should the nurse monitor prior to the procedure? What do you think?
Findings should not monitor prior to the procedure. Prothrombin bilirubin. I go with C, bilirubin.
What is bilirubin?
Oh my God.
The only reason why I'm asking is I'm wondering, why are you selecting bilirubin if you don't know what it is?
Bilirubin,
I
think, is the process of knowing when I don't know how to explain that.
Let me tell you what it is real quick.
Okay.
Bilirubin is the waste from red blood cell breakdown. So you have these processes in your body. This particular process known as hemolysis, where hemo means blood, lysis means destruction or breaking down.
Okay.
Okay. Liver biopsy. Explain the procedure to me, Mr. Tayo.
The liver biopsy is the process of getting, like, cutting. Is a surgical process of getting into the liver.
Not surgical, it's the needle, right?
Oh, yeah.
The needle. So what are your concerns?
My concerns are bleeding.
And
getting to the lungs.
Good. Those are your two concerns, right? Those are your two.
What I need to do?
Hold on. Let me hold on. Let me show you something real quick, okay?
Yeah.
If you look at your hold on real quick, sorry. If you recall, do you remember these things right here?
Yeah.
PT stands for prothrombin time. PTT stands for partial thromboplastin time. I need you to understand that the words thrombin deal with clotting. Okay?
Yeah.
So anytime you see the word thrombin, that has something to do with clotting, with your body's ability to clot, which are also directly related to bleeding. Can we agree on that?
Okay.
Okay. So then we go back to the question. What
Uh,
lab would you assess?
I will assess the A, prothrombin time.
And that is correct. You see that?
Yes.
Because that is a lab value that is associated, that's related to medications that thin your blood out. So we want to look at that one.
Okay.
Now let's talk about the ones that you were selecting. Bilirubin, we talked about that. This usually says bilirubin is monitored to direct biliary obstruction and does not need to be monitored prior to this procedure. We'll discuss what that means in more detail in just a bit. Serum lipase is the fat, and the calcium is the electrolyte. So because of the procedure, because we're having liver biopsy, and you know that the liver is vascular and they may bleed out, then we have to consider anything that deals with bleeding, and prothrombin time is one of them. Does that make sense, sir?
Yes, sir.
All right, let's move on to the next one.